This is the Ulthera machine that a lot of people have been hearing about recently, and I'm personally very excited about it. We've been looking at it for the last 2 years, and we've been using it for about the last 2 months with excellent results with our patients. What's unique about this, it can both lift and tighten the face, the neck, and the brows, and even some other areas on the body, non-surgically. So we can actually target the muscles and the skin in areas where we want to lift it without having to take the patient to the operating room. It's a treatment that's done right here in the office. This is the transducer that we use, and basically, a little bit of ultrasound gel is placed on here. We have an ultrasound screen. Everybody knows about ultrasound from having babies. And Clarinda here is, we're gonna look at her anatomy on the screen. So when we're treating the neck or the face, it's going to feel a little cold when I first put this on. So when we're doing an actual treatment, we place this on, and if you look at the screen, I'm going to hold one hand here. This is the level of her skin up here, and this is the level of the muscle. And the muscle has a lining, and you can actually see where we'd be treating right there. So if I was actually going to be treating her right now, I would hit the button and it would fire, and she would feel a little bit of almost like a warm electrical type of stimulation in her muscles. And so when we treat the neck, the face, and the brow, takes about an hour to an hour and a half, depending on how much of the face we're treating, and the patients are able to tolerate it right here without having to go under anesthesia.
Is that normally one treatment or multiple treatments that it takes?
This is considered a one treatment modality. The original patients were treated approximately 2 years ago at very conservative settings. Some of them are coming back about a year and a half later and desiring more tightening as aging continues. We feel now that we're treating not only the superficial layer but also the deep layer, and we're treating at greater than 50% more energy, that the results should be lasting a little bit longer.
How long until the results kick in for a lot of these patients?
The results of the treatment, some patients on the table, they can see about a 10 to 20% improvement immediately after the treatment. Oftentimes we'll treat one side of the face and show them the difference between the two, and that's about a 10 to 20% preview. I've had some patients where they've seen improvement right off the bat, but in general, we tell patients it'll take about a month or two, and improvement continues up to 6 months.
Okay. And anyone ever noticed any side effects? Is there any concerns? Or
the only side effect that has been reported has been a little bit of weakness in one of the facial nerves that moves the mouth. That's been very transient, lasting maybe a week or two. There's never been a permanent side effect from that. And the only other concern is occasionally a patient will have a little bruise on their face for a few days.